This is Optometrists Building Empires, and I'm your host, Ankit Patel. Each week, we'll explore the journey of multi-practice ownership and leadership in optometry. Join us for insights and strategies from the top minds in our field. This show is sponsored by My Business Care Team. My Business Care Team helps your office increase revenues, reduce costs, and reduce staffing headaches. Let's build your empire together. Today's guest has a unique story to share with us, I think, today. He's actually a third-generation optometrist, continuing his family's legacy in eye care. He leads his practices program in infancy program. It offers free eye exams for infants under 1 year. He also serves as an associate staff for Charles Cole Memorial Hospital. He's the optometrist and owner at Schott Associates Eye Care. Please welcome Dr. Dan Schott. Dan, welcome.
Hi, Ankit. Thank you for allowing me to be part of your project.
Yeah, I'm glad I'm going to speak to you because I think you're the first person we're talking to that actually has a generational business.
Okay.
And so I'm excited to hear what that is going to entail and your perspective on it. So let's jump in, right? So our first question is, what was the most important thing that helped you grow your empire?
Well, I mean, as you mentioned, I grew my empire the old-fashioned way. I inherited it, but how we've been able to maintain and grow it in the first place, I think is the same way that my dad kind of taught me to do this job, and that's focusing on community first. Ultimately, we feel like our job within a rural area that we serve is to meet a need, and you have to always be focused on, what needs are we trying to assess, and then also the area changes, the communities that we serve, they're not, they're amorphic, they grow, they fall, they change, always are changing. So you always have to have your ear to the grindstone and trying to figure out, always thinking about that question, what needs are we serving? What communities are we serving? What populations are we serving? And those sorts of things.
And help me understand a little bit about some of the challenges you've been running into, whether it's owning a multi-generational practice, having a couple of locations. What are some things you ran into that you didn't expect?
Oh my, on a day-to-day basis, there's always stuff that you don't expect for sure. So I'll give you, I guess, a little background of the 20 years that I have been, with the practice or whatever have you. I mean, when I first came into the practice, we were a little bit worried so far as volume goes, adding me as an associate employee. So, we had grown the practice up to 3 office locations when I first got out. And then my dad was looking toward retirement. So we started to plan for that and downsized to 2. And then we hired an associate. So that was good. So we expanded back out to 3 again, and then the associate left. So we've since consolidated here recently back down to 2 office locations. So, so I think that, trying to balance that, what we want to do and you want to help everybody that you possibly can help. But at the flip side of that, you always have to have that reality of what you can physically do. Because you just, we're human beings. We're just one person. So sometimes we just cannot possibly do everything. And that's important to recognize.
Interesting. So can you tell me any story about when you thought you were able to do everything, but you weren't, and how that kind of impacted the business?
Oh my. Yeah. That I think is everybody when you first graduate from optometry school, and myself included. You come out, you're full of fire and brimstone, and you're the greatest thing since sliced bread, and you're going to come in and fix the world. And you get into the business and you're working through it, and you're just I wouldn't say it's any seminal moment that you're like, oh my gosh, I just I can't do this anymore. But you just start to realize that there's just things in this life, there's things in this world that you cannot fix, and not that you can't help patients. That's a different thing. You always are trying to help patients to, psychologically or physically, manage loss and manage function loss. And blindness is obviously a very catastrophic, bit of news to hand to somebody sometimes. All right. But, there's only so much that we can do. And I'd say that myself and my personal professional journey where I recognized that I can't do all of this was, probably about 2016. That was a pretty, I guess I wouldn't say traumatic year, but it was just a lot of changes that year. We had, a local ophthalmologist, he retired, my dad retired, the amount of healthcare or eye care in the area kind of got halved. And I, at the time, had built up and been working a little bit more closely with the hospital here, doing their low vision rehabilitation clinic. And we had kind of grown that out to a standpoint, but just looking at, again, the needs of the community, like, the closest ophthalmologist to once the one that was here retired was probably a good hour's drive one direction. So a 2-hour drive and to get to that level of care. And so again, the needs of the community changed, and I personally had to do a reassessment and think, well, as much as I love to do low vision rehabilitation and I enjoyed being able to do it, and we had all the capability to do it, it wasn't a priority. You kind of had to triage, so to speak, figure out what was the most important things that we needed to be bringing to the table right now. So I would say that's, in my professional journey, kind of like the decision that was the greatest. Like, I can't possibly do all of this, and then the other standpoint is that, as I got a little bit older, once the other associate left in 2019, I did keep 3 office locations going for 2 or 3 years. And then that just got to the point where I'm a little bit older. I just physically couldn't handle the, not necessarily the patient care side of things, but you always have all those other things that you're dealing with as a practice owner, so far as facilities management and personnel management. And, every time I would walk into, the office location that I could only get there 1 day a week. So I'm trying to handle a full week's worth of problems in a day, and then I get to walk into another office the next day and handle a whole week's worth of problems, the next day that, sometimes are just simple things, but they're all on your plate because the buck stops with you. So that was another time where I think, like, man, I just physically can't do this anymore. I need to step back a little bit and figure out how we could possibly do that.
Yeah. I think it's interesting because it sounds like you can't do everything, right? It's based off of what your community needed. Back to your main reason why you're successful. Your community needed something else besides just a low vision. Like, I can do it all, but I just not what the community needs, and it just doesn't make sense. So I think it's a really cool story.
Mm-hmm.
So you're third generation, right? So one, is there going to be a fourth generation? Just curious, or do you know?
I don't know. I hope deep in my heart, I always hope, but my kids are getting a little bit older, and it looks like they're being drawn in different areas, different desires. So, as much as, my personal, preferences would be different than that, they're their own people, and they have to make their own path and carve their own life and support them any way we can.
That makes sense. And so I guess what made you want to grow your family empire? Like, what made you want to stay? Like, why do it?
I think that when I went to college and undergraduate university at Ursinus College, I actually went there to be a chemist. That was my original major, was chemistry. I actually was not part of the pre-med program at that point in time. And, but I always had a strong draw to the area, strong draw to my communities. I think that, knowing the importance of, what my dad did for the area, and at least having a rough sense of that, that was always something that was interesting to me. And I can remember distinctly, being in the chemistry lab and just thinking to myself, I'm not really, I'm just sitting here looking at test tubes. I'm like, this is miserable. I don't want to be at this side of science. I want to be the application side of science. I want to be able to take these things that these great scientists create. And I'd rather be on more on the application side of things. I want to be able to put these things into people's hands and show them, how that they can improve their lives with these products that these wonderful scientists make. So it was just that I realized when I was in the chemistry lab and actually in the major that was more of a pull for me, that I wanted to be more on the application side of things than on the creation side of things. Cause, I think that sometimes you're a scientist, you can create things with some intent, and then you send them out there in the world, and, people get a hold of them and do maybe some very different things than you had in mind with them, so.
Yeah, that makes sense. And so since you had that exposure from a young age, you're like, well, I think I could make this work. So it's kind of neat to see.
Yeah.
So now, one of the things that a lot of folks are dealing with right now, and I'm sure you are too, uh, your non-doctor payroll, or your staff costs going up. Are you dealing with that as well? And if so, how do you manage through that?
Um, so we are, obviously always cognizant of that. I would say it hasn't been a huge problem for us, here recently, mainly because of the downsizing, that we did close an office location. And with that, cut our payroll down by having to let go of a couple of ladies that were employees of ours. So, that was a hard decision. They're great people, great individuals that we had to let go, great employees that we had to let go. Um, but I think at the end, talking with them, in the couple years since, them, I think it's worked out well for everybody, that we're all okay, that we're all doing fine. But that was hard. But, on the flip side of that, from a business perspective, that freed up a lot of payroll that we can then, kind of like pour into other resources that we've had, and we've been riding that train, I think, ever since we're building up and being able to pay the people that we have, the wonderful staff that I do have right now. They're, keep working them up, trying to help them offset the problems that come with inflation, and the problems that our whole country is facing, from the top to the bottom right now. And working through that. So you always want to handle those situations well, and to make sure that you're paying your people as they should be paid, and making them happy, because they represent you from the start to the back.
Gotcha. Okay. Let's jump into another question. I think you might have fun with this. So, reimbursements, insurance reimbursements aren't necessarily, they're not getting better, right? In some cases they're going down. How do you deal that with your practice?
You always have to find ways to monetize what you have, and that's definitely a challenge. Like you said, you can't always rely on your business partners to have your interests front of mind. So, I think that whatever you enter into, say, a consideration as to whether you're going to take an insurance, or if you happen to get into a situation where you can actually negotiate a little bit, then I think that you always have to, put your needs first and foremost, because you're the only one that's really truly going to put those on the table. And then, when you're dealing with, patients, and again, insurance companies aren't always 100% looking at, giving you the blank check to do everything that a patient might want to do or might need to do, so, you have to be able to, communicate those with patients. And then, when there is things that you want to bring to the table, things that will augment their care, that you feel have value. I think that there's always people out there that are willing to put money into things that they understand the value that you're putting on the table. And we as optometrists, I think, constantly undervalue what we put on the table. I think that's been a bit of a long-term issue for our industry. And I don't know, I'd like to ask you a question, if that's okay. I don't know, that's a little bit different, but
Yeah, sure.
I thought of one question, and this was just something I wanted to get into a little bit, but, what is like an optometrist versus an ophthalmologist, and how would you define those differences?
Oh, my layperson definition is ophthalmologists do surgery, optometrists don't. Now, that's not true in well, I mean, there's a lot of gray area there, but that's the layperson definition I use. I think there's a very specific scope of practice in each state by state that you could use as a definition.
Yes, exactly. So yeah, I think that's a great point. And I think that that's the most common answer that you will get, is if you're talking about like an optometrist and what we put on the table versus ophthalmology and what they put on the table. Like, we've been defined by things that we can't do, right? You never want to be defined by what you can't do, right? That's not great for your industry. Like, oh, we can't do that. Like, well, that's not a great thing. That's not a great way to think about yourself as an optometrist. So I try to, and I work in a hospital. I work with a lot of other physicians, and so this is kind of giving me perspective to think about like what we do bring to the table. And I tend to think of optometrists more like optical engineers, you know what I mean? Or the way that we problem solve is going to be to look at function first. And then if the function isn't there, then we tend to go to structure, and try to figure out why that is. Versus an ophthalmologist goes the other way. They look at structure first. And then if the structure and the function don't match, then they'll try to figure out where the function comes from or what the functional problems. So, so I think that it's just, we solve the same problem, but optometrist is going to take it from a function standpoint and then come around to structure if we're not getting the function we look for. Whereas an ophthalmologist is a structure expert. They're going to look at structure first and then have an expectation for what they expect the function to be. And sometimes they will, and when I did low vision, you would run into that where they would look at the structure and say, this eye should be able to see this. And then they would kind of like do something that got what their expected value is and then stop when there was function that you wouldn't necessarily expect to be there that you can kind of parse out and get. So, so to me, that's always been like something that we do as an industry that I think, undervalues ourselves. And the reason why we constantly kind of run into that is because I think it's better for optometrists to think of ourselves as function experts. Like that's really what we do. And then, we'll find the structural abnormality, if we can't get the function.
That is a brilliant way to describe it. I actually have never heard of that. I love that. I love, so if I'm going to build off of that, it's functional first. So it's about, hey, you know what? Optometrists are your primary point to make sure your eye is working properly.
Yeah.
Right. Everything that your eye needs to do to work properly, optometrists can help you with.
Yeah.
If there's something that's physically or structurally wrong with the eye, then they can refer you to the right specialist, the ophthalmologist for that.
Yeah. I mean, basically, yes. If we're not getting the function, and it's not that we can't do the diagnostic side of things and try to find the structural abnormality, but, and I think we will do that. And then once we do that, then we can make the proper referral, and that again brings us back to our primary care role where we should be, I think, focusing our efforts and that sort of thing. So yeah, I would caution optometrists, especially and I think that's given us problems within like simple things such as reimbursements for say like refractions, where a refraction isn't usually paid for by like a medical company, okay, or Medicare, but a refraction is really a very important diagnostic test for an optometrist because that's going to be a very sensitive way for us to try to parse out function. So, I think if we could possibly get it presented across that this is so vital for us to function, and when you're not allowing us to do this and not reimbursing this code, you're really tying our hands behind our back as far as the way that we function within the medical community. And we could do so much better for you medical community if you stopped, not allowing it or not reimbursing us for some of these things that we need to do.
In our offices, we talk a lot about preventative care. And it seems like at least in the US, which is what we're talking about here, really good at chronic and acute cases of issues, but preventative is not as, like to maintain function that's already existing is not as valued as much as, oh, now you have glaucoma or diabetic retinopathy. Now we're willing to reimburse you for that. So part of it, I wonder how much is systemic and what the insurance companies and people pay for. But it's interesting. I love that approach of because it is, you're right. It's everything. It's acute, it's chronic, and it's preventative. And it's making sure that, hey, your function of your eye is working properly your entire life.
Yeah.
And I'm not an optometrist, but that's what optometrists do in general.
Yes. I think that's our wheelhouse. We really should embrace that, that role, and that's great. But, and then as for, so that's a couple of ways that you're trying to improve, the reimbursements, getting back around to your question eventually. But the flip side of that is that, private insurers are not always going to look at that. They have investors. They're looking at, dollars and cents, what can be effective and cost-effective healthcare and all that other stuff. So, so every patient that comes in, you really have to see that as an opportunity and then figure out how you're going to monetize that opportunity within your chair. What things can you bring to the table? What capabilities do you have? What diagnostic tests do you have in office that you can put on the table and explain to the patient as to what they're doing and figure out what those profit centers are for your business or for our business in particular, for anybody's business in particular. and really, hone in on those to kind of fill in the gaps, because at the end of the day, I mean, the community needs you to be there. They do. And so, again, that's part of your job, as much as we don't like to think of ourselves as, being motivated by profit or being motivated by these sorts of things. You really have to have, I think, a realistic expectation that you need, you have payroll to meet, we have costs that we have to meet. And, it's going to be far better for the community to keep you employed and in that community than it is to just kind of like feel bad for ourselves and go out of business. That's never anything that's good for anybody.
Yeah, absolutely. That's really, I love that framing. I've never heard that before. I love that. I'm going to use that. Is it okay if I steal that?
Yeah, you can steal anything. Take, use it.
Right.
Absolutely.
I appreciate that. What keeps you up at night? What do you have? What are the things right now that's on your mind? That's like, this is something that's racking my brain right now. Either, business related or optometry related.
Well, I guess one of the things that's, racking my mind on a daily basis is part of the reason why, I'm here talking with you, is, we've been trying to hire an associate optometrist to come out and help, for the last 5 years. And, I think that, most recently I started to look at the problem, because we don't have nearly the problem like hiring staff that I think a lot of people do. I think part of that is, our branding within the community. We're known to be, a good employer. I think that things that we did in getting associate or support staff helps us out a lot. And some of it's just real simple stuff, like maybe, having employee get-togethers outside of work, and then taking pictures of those get-togethers and posting them on social media so that everybody can say, hey, look how much fun these guys are having, and look at what a great workplace this is. And then, trying to keep staff happy and keep everything light so that when patients come in the door, they see, staff that's smiling, and that helps your bottom line. And I think it also helps you with recruiting, other people to come in. Nobody wants to come into, a place that's not positive and not a good environment to be in. And so thinking about the problems that we've had hiring a professional, I just thought, well, maybe it'd be worthwhile trying to, expand out my brand, I guess, within the professional community, because that's never been anywhere that I've focused on, because it's so far for me to get to, association meetings and those sorts of things. So I thought, well, these might be some good avenues for me to try to, increase our recognition or increase our brand within the professional community, and maybe that will help us to, to find, that right piece that we've been looking for, that person to come in and join our group and join our staff and kind of take us to the next level again and beyond. So, so that's part of the reason why I decided to come on this podcast. Thank you very much for inviting me. And, part of, I've been trying to make it to more association meetings and be a bigger part of the professional community, because I think that networking is always, a positive thing. So just, so that's part of what's keeping me up at night, part of why we're trying to always problem solve, always figure out different ways to go. Because I mean, there's so many smart and competent people in our business. They're frustratingly competent, like the other people that are around us. They're so good at what they do. And I feel like every time I find like a new little angle, like, I'm going to do this. And I look there, and like 15 of my partner or 15 of my colleagues have already done that and are already in that space. So they're amazing people that we work with, and they make it difficult, but always a challenge. Always happy to be a piece of this great community of optometry.
Yeah. That's awesome. It is a small community too, I've noticed. It's about 100,000 or so. Anywhere from 40 to 100,000 is what I've seen as optometrists in the US.
Yeah, that seems about right. But
it's I know it's a big spread, but that's what I've seen. So you're right. It's not a huge community.
No, it's not. They're always fun people to talk to. I think always grounded. I mean, when I talk to other doctors, especially like when you get up to some of those higher level specialists, neurologists and that sort of thing, sometimes they're so focused on the disease side of things that they forget the personal the way to talk to people, I guess, so to speak. So yeah. I usually try to caution my patients when they get up to some of those like tertiary care levels. I go, you're going to go see this guy, and he's not going to be the most personable probably, but he's really, really good at what he does. So don't take this terseness yeah, you've run into that. You know what I mean? Where you send somebody to
Oh yeah.
like the best specialist in the world, and they, the patient kind of has one expectation, and I'm like, this guy is really, really good at what he does, but he doesn't talk to people like on a personal basis quite as good. So always try to make sure that they're ready for that.
Yeah, that's good. So let me ask a question. What excites you about the future, either about your business or the field?
Um, what excites me about the future? Um, well, I think that there's so many interesting areas of optometry that are just coming about, whether it be, myopia control or, these diagnostic tests that we have, nowadays. They really help me to make better referrals, that's for sure, and be more effective at my job, that's for sure. A lot of times when I'm sending somebody to say like a tertiary care level, say to go see somebody about retina or something like that, that might be a 4-hour drive down and back for that patient. So, if I can be more accurate with my diagnosis on the front end, that saves that patient a whole half a day, of aggravation just to go down there and find out that it was nothing. So the improvements in the way that the technology is just, it's so fun. And looking back at, I've had even patients come in and talk to me about, what would your grandfather have done with this equipment? And I'm like, well, he probably would have done the same thing, just a whole lot better than he did it back in the day, just because of the limitations of what he had and what his training was. So, so that's interesting. I just got laser certified about a month ago, went back to school, I guess, so to speak. So in Pennsylvania, we can't do that yet. So that's kind of like, kind of putting, but I went back to school to get that, to try to help the profession along a little bit. I encourage colleagues always to, be cognizant to what the POA and the AOA or your state organizations, would recommend, and where they're trying to go, always try to help them.
That's great. Well, thank you, Dr. Dan Schott, for being a guest.
Thank you.
Yeah, and thank you, audience, for listening. If you learned something, had some any insights or epiphanies, please share and tell everyone about the podcast or YouTube videos. Thank you again, Dr. Dan Schott. And this has been another exciting episode of Optometrists Building Empires. And we'll see you next time. That's a wrap on another episode of Optometrists Building Empires. Thanks for joining. For show notes and more, visit buildingempires.live. This show is proudly sponsored by My Business Care Team. My Business Care Team was born out of staffing challenges my wife and I faced together, managing multiple optometry locations. We refined our approach at Classic Vision Care and now offer our expertise to others. If you're experiencing challenges with staffing and you'd like to set up a discovery call, we'd be happy to help you and connect you with the right resources. We'll see you next time.